So we don't want food to be the elephant in the room when people are discussing their type 2 diabetes management with their healthcare professional. And so we think that people with type 2 diabetes and their healthcare professionals alike, if they're able to have an open, an honest discussion and understand the role that food plays in keeping healthy and managing their diabetes, that actually this is a good thing. All of us have the ability to eat for health while still enjoying the food that's on our plate, so that it's varied and balanced and interesting and healthy and affordable, and all of those things are really important. My name's Lynne Reedman and I'm founder of Duet Diabetes and Service Lead, and I thought it would be great to have a chat today with Rachel Page. Our paths crossed earlier this year,
Yep,
didn't they?
maybe.
And I thought it would be good for us to have a chat and to be able to understand and for you to share some of your knowledge and expertise around food and nutrition, and in particular, for people that are living with type 2 diabetes. So rather than me explaining who you are, I will pass the camera over to you, Rachel.
Okay, well, thank you, Lynne. So, hi, my name is Rachel Page. I am the owner of Rachel Page Nutrition. I am a BANT registered nutritional therapist with a special interest in people with who are living with type 2 diabetes, and I help them to balance their blood sugar, to get their energy back, and to sort of live the best life that they can. Okay, so I've got a family history of type 2 diabetes, and I had gestational diabetes myself, so I'm aware of sort of the issues that it can cause, how scary it can be actually, and sort of how is the best way to sort of manage it.
Absolutely, and some of the challenges and what have you.
Exactly,
too. Yeah, no. Well, that's really interesting, and thank you for sharing that, because you've got that personal understanding. So, can you tell me a little bit more actually about what you do then with your qualification, what it is that how you can help people?
Okay, sure. Well, I'd just like to start with a little bit of a disclaimer. So I work individually with clients. I work on a sort of one-to-one basis, and when I do that, I'm able to take into account their family history, their personal history, things like their medication, their lifestyle, that sort of thing. So I'm able to tailor that to them very specifically as an individual. So what we're talking about today is obviously much more general, because anybody who's listening, obviously I don't know what their particular situation is. So this is a bit of a disclaimer. It's not. This is not medical advice. I'm not a doctor. I'm a nutritional therapist. So I work with food and I work with lifestyle to improve people's health.
Oh, thank you. That explained it brilliantly. Thank you.
Great.
Don't worry about the disclaimer, and that's the thing, isn't it? Everybody's different.
So there are many aspects to controlling type 2 diabetes, the sort of blood sugar control. So one of the major things is what we eat and drink, so the food that we consume. However, there are other things that have a big impact. So these can be things like stress, how well we sleep, how well we look after ourselves in different ways, and the exercise and movement that we do. But today we're here to sort of focus on food and drink specifically.
Yeah, no, absolutely. And it's interesting because you talk about it, you mention about blood sugar, and we often hear about blood glucose as well.
Yes.
So is that something that you can just sort of explain to people? Because are you talking about the same thing? The different terminology, but is it the same?
Okay, so yes, it is the same thing basically. So technically it's more technically correct to use the phrase blood glucose, but people tend to understand blood sugar a little bit more, but they can be used sort of interchangeably. Glucose is simply a type of sugar. The sugar that people put in their tea or on their cereal is a combination of glucose and fructose, and then when your body absorbs that, it's the glucose that goes into your blood and is taken to your muscles and then should go into muscles to be absorbed for energy. The problem with people with type 2 diabetes is they get high levels in their blood and they don't necessarily get those levels, they don't get that glucose out into their muscles, and that can cause things like fatigue, but it also means they have high levels of blood glucose or blood sugar, and we know that can be very damaging, and that can cause a lot of complications with diabetes, type 2 diabetes.
So you mentioned the glucose, and you mentioned the sugar that goes in your tea and what have you, but actually it's about understanding where else that glucose comes from, isn't it? Because obviously it's not just from the sugar that people might put in their tea, it's from other food stuff. So I presume you'll probably enlighten us a little bit more about that as we chat this morning.
So glucose is obviously, sugar is obviously, in the sugar that we use and that we can see, but it's obviously contained in other things. It's contained in sweets and cakes. Again, that's sort of reasonably obvious. But there's also other foods that are broken down into glucose. So anything that contains carbohydrate will get broken down into glucose. So those are savoury foods that include sort of bread and potatoes and rice and pasta, and all of those get broken down into glucose. They get broken down at different rates, and that's the sort of difference. But ultimately, they do all end up as glucose and will end up in the bloodstream.
So I suppose really what we ought to have a chat about now is what we'll move on to is the sorts of things that what foods people with type 2 diabetes should or shouldn't be eating, or should or shouldn't be avoiding, or that sort of big question really.
So in terms of what people really should try to avoid, it's the things that we've just mentioned. So it is things like sweets and cakes and biscuits and fizzy drinks that have got high sugar. So that's all sort of reasonably obvious. There's also can be really high amounts of sugar in some savoury foods. So as well as the carbohydrate-based foods that I mentioned earlier, the sort of bread and potatoes, a lot of ready meals and a lot of processed foods actually contain high amounts of sugar. Things like certain crisps can actually really contain a lot of sugar. You think of them as a savoury snack, but they're the sorts of things that have hidden sugar in. So there's a lot. Sugar is in a lot of places that you don't necessarily know.
No, and I suppose that comes down to it when you're buying foods that are more processed. It's about, I suppose, starting to understand the labels, isn't it?
Exactly,
and see what you're looking for.
Yeah, it's about checking labels, and it is a really complicated area. Things are hidden, and it can be really difficult to navigate, and it can be really helpful to have some guidance on that and have some experts sort of help.
A sort of question that's kind of popped into my head really is, because you talk about sugary things and fizzy drinks and sugary foods and all the rest of it. Something that people often ask us when we do some training around food is the question of sweeteners. About cooking with sweeteners, like baking with sweeteners, or having the low sugar drinks that have obviously then got sweeteners in. What's the thinking around that?
Okay, so it is really important to try and reduce the sort of number of fizzy drinks that people have, and this sort of sugar content in general. But it is more complicated than just substituting a sort of a full fat, full sugar, as I say, Coke, for a Diet Coke or something like that. And there's a couple of things on that. Partly is because you're not then, your body doesn't really recognise the sweetener. It finds it very hard to process. That can have a damaging effect on the beneficial bacteria that you have in your gut, which then can cause other problems. But also your body is still tasting that sweet taste. And what you really want to do is sort of try and educate yourself slowly away from having that sort of sweet craving. And so by substituting a diet drink, for example, you're not moving away from that sort of sweetness, but your body can't really process it very well.
Okay.
So it's quite a complex area.
Okay.
But I would say, if you are wanting something fizzy, maybe sparkling water with a squeeze of, lime juice or something, that can be quite refreshing, rather than just going for a diet version of a sugary drink.
Okay. And with regards to then sort of sweeteners, like I said, if you're using them in cooking, like baking or what have you, we hear about the sort of more natural sweeteners rather than the like manufactured ones. Is that the right terminology? So really, in general, the sorts of things that you should be looking to have in your diet are things that
are more natural. Anything that's really manufactured, your body may have difficulty in sort of recognising and processing it. So yes, if you, I mean, something like sugar, something like honey will have, you know, really high sugar levels. So you might want to, you know, not go too heavy on putting honey in your baking, but it would be better to put honey in because it's a natural product that your body can at least process than an artificial sweetener. So, I mean, generally the sort of rule is if you recognise the thing on the label, then that's a good sign. If it's something that, you know, you or your granny might not have recognised, you know, anything that's sort of really processed and manufactured, that's sort of the type of thing that you should really be avoiding.
Okay. Thanks for that, Rachel. That was really useful and in helping people understand the sorts of things that perhaps they should be trying to avoid. Can you kind of share some of the things that people, you know, should be eating, or, you know, should be encouraged to eat if they have type 2 diabetes? Can you kind of expand on that?
Yeah, sure. So there's luckily, although we have been talking about things to avoid, there is actually, you know, loads of things that people who have type 2 diabetes can eat. So and there's evidence that if you try to increase, you know, the things that we want to have more of, then that sort of crowds out some of the other things. So it's often better to sort of focus on what you can have and try and increase that than worry about sort of cutting out things, because then that sort of happens a bit more naturally. So the things that we should really be focusing on, things like vegetables, poultry, beans, nuts, seeds, olive oil, oily fish, those sorts of things. You know, you can make some amazing meals, it can taste fantastic, and it will really, really help to stabilise blood sugar levels if we're focusing on those foods. When we talk about sort of eating sort of fruit and vegetables, we should really be focusing on vegetables rather than fruit. It's okay to have probably a couple of portions of fruit a day, but that should be the maximum, because actually there's quite a lot of sugar in fruit. And people should eat whole fruit rather than have fruit juice, because fruit juice is really high in sugar actually, and if you drink a whole glass of fruit juice, that has the same impact on your blood glucose levels as sort of drinking sort of a glass of fizzy pop would. So if you do have fruit, make sure it's whole fruit rather than fruit juice, and eat some protein with it as well, because that helps to sort of slow down that absorption into the blood, so you don't get a big increase in blood sugar that will then sort of drop down.
So they don't get that big spike and that kind of yo-yoing.
It's about trying to make it as stable as you can rather than going up and down throughout the day.
And do you think that's one of the, you know, sort of, not problems as such, I don't know quite what the word is, but one of the things that people perhaps don't realise, because we think about fruit as being healthy, and so with somebody with type 2 diabetes, you know, might think, oh, this, you know, fruit smoothie or this fruit juice that is just basically mostly fruit, and they drink a great big one of those every day, or more than one a day, and they think they're being really, really healthy, but actually they're not helping their diabetes.
Completely. That is, that's it. I can't add anything more to that.
Right,
You've nailed it.
No, that's good. But it sounds to me as well like, you know, from what you're saying, you know, is because the other thing I think to point out, isn't it, that there isn't a special diet. There shouldn't be a special diet for somebody with diabetes. It's about kind of eating for health, or just having that kind of general good quality, balanced, varied diet, and that's actually what we should all be doing, really.
Exactly. So the things we've been talking about are great for everybody. It's not just for people with type 2 diabetes. So I mean, actually, if people followed that sort of diet, they would improve their health in other ways as well. So it wouldn't be just that they were able to balance their blood sugar. They could also, if they've got issues with blood pressure or with high cholesterol, that sort of thing, actually, they can improve those as well. So it's really good for a lot of people. However, as I said before, you know, these are general principles for people, and different people will have different needs, particularly if they have other conditions or other things to think about. So it is important to have a sort of individual sort of one-to-one approach, because then you can get something that's really tailored to you.
Definitely, absolutely. And I think it seems to me that one of the key things that somebody with type 2 diabetes could take on board is if they do like their fruit, is thinking about how much they're eating,
Yeah.
and maybe it's more. I know you said to me when we chatted, one of the first conversations we had is that you like to turn it around the other way. You don't say fruit and veg, you say veg and fruit. So,
yeah, I did notice when I said it earlier, actually I said it's fruit and vegetables, because that's the way people think of it, but really you should think of vegetables and then fruit.
Yeah, no,
So if you're thinking of 5 a day and you're going for 5 fruit and no vegetables, then you need to sort of turn that
think that around. Yeah, no, and that's really helpful, I think. Well, I think so anyway. I hope other people do too.
Great. And so I should just mention that we're talking about, you know, shifting from fruit to vegetables, but actually it can be really, really hard for people to change their behaviour, because, you know, there's habits, there's preferences. It can be really, really difficult, and sometimes just by making small changes. I've had clients who say to me, "Oh, I feel so much better. I'm not having cravings any longer." And then, you know, if you can sort of balance your blood sugar a little bit, and then that helps stop cravings, and then that helps you stop your blood sugar sort of spiking, and so sometimes small changes can make a big difference, because they accumulate.
Definitely, because I think if people feel that they're faced with having to change so many different things, then you can understand why they just kind of think, oh, I can't cope with that, or I don't want, you know, they just don't. The motivation just then isn't there, because it just feels overwhelming, actually, and they're trying to also deal with the fact that they're living with kind of a long-term condition. You know, with their diabetes, they might have other health sort of issues as well, as many people do. So I think you're dead right there. It's about having. It's the little steps, and those little steps will all start to accumulate, won't they?
Exactly.
To make a difference over a period of time.
And that's it. I work with my clients to tailor that programme to something that they're comfortable with. You know, they can do a step at a time, and it might be that, you know, you focus on breakfast first of all, or it might be you focus on snacks, or it might, you know, some people want to go the whole hog, you know, and really go for it. But that doesn't work for everybody. So it is about finding what works for different people. And, you know, people know what will work for them, but they need some help in working out some of the complexities of it.
No, definitely, and I think by doing that, it also makes it achievable. It's personal and achievable, rather than just being given a blanket. This is what you need to do. Off you go. Actually, having somebody that can help understand you as a person, and what will fit in around your lifestyle and your sort of eating habits currently, and what you're trying to achieve, and family life, and the whole shebang, really.
And you know, some people work shifts, some people have access to cooking facilities at work, some people don't. So there's a whole range of things that we will look at and tailor it to individuals.
I'd like to just rewind you a bit with something you actually said a couple of minutes ago, if that's okay. You mentioned olive oil. And I think this is a bit of a tricky one, is people getting their head around the quantity of fat that we should or shouldn't be having in our diet, and so what's the current sort of thinking, and what's the role, and can you explain a bit more about that?
Fat is a really complicated area, and over the last few years, you know, fat has got a really bad reputation. However, it's not entirely deserved, because there is some fat that we need. We need essential fats. There are certain fats that we can't make in our bodies, and we need to take in. And fat is really important for our health. So we need it to absorb vitamins. We need it to make. Every cell in our body needs fats. Our brain health, our immune system, all of those need fats. So when you said about the sort of quantity of fat, I'd actually say we need to look at the quality of fat that we have. We do need to keep an eye on the quantity, because you know, there are different types of fat. It's really complicated. I won't go into all the details now, but we need to focus on getting the right sorts of fats. So in terms of the sorts of fats we should be looking at more sort of polyunsaturated fats, things like walnuts and oily fish. They have omega-3 in, which is really important. So without adequate quantities of the right sorts of fats, our cells find it difficult to function properly. One of the issues of people with type 2 diabetes is they have a lot of glucose in their blood, and it struggles to get out of their blood and into the cells where it should be. And there are many reasons for that. One of the reasons can be if there is a little bit of a lack of flexibility within the cell walls, and by increasing some of these sort of omega-3 fats, you actually can improve the absorption of glucose from the blood into cells, because you improve the quality of the cell walls. And that's additional reason why people with type 2 diabetes should really focus on getting that essential fat.
Yes, yeah, and it's making sure it is the right sort of
The
fat.
right sort, yeah.
Absolutely.
So just while we're on fat, actually, I would like to just mention one more thing, and that's to say that if people are thinking, do you know what, I will try and be healthy, I'll choose a low-fat option, they really need to be aware that actually, quite often if you go for a low-fat option, it means there's added sugar in there, which is added to make it sort of taste okay. So I would really recommend that people avoid the sort of low-fat options and actually go for the more natural products. So in terms of yoghurt, I would maybe say have some Greek yoghurt, some full-fat Greek yoghurt with a few berries in it,
Right.
and that actually is better than if you had a low-fat yoghurt that had loads of sugar in, and I have to say it tastes really nice as well.
That's true, and it's really important, isn't it? People have got to enjoy their
it,
food
yeah, definitely.
as well. So they would be, so using your example, so you're saying that effectively they'd be better off going for something like the Greek yogurt, but it's just also about looking at that portion size as well, is it?
Yes, yeah. I mean, you know, people do have to be sensible. Any of these things that we're talking about, you know, don't go mad. You know, olive oil is great to have on your salads, that sort of thing. But you know, you wouldn't have gallons and gallons of it. But it's great to have, and it makes salads taste nicer. So you're more likely to then, you know, want to eat more salads, which, you know, is getting those vegetables
more
in.
enticing. Yeah,
So
yeah.
it's about being sort of sensible. But I would say in general, low-fat foods are often high sugar, and again, it's about checking labels.
So are there any tips that you can give for sort of certain groups of people? For example, like older people, you know, it's something that, you know, I'm quite passionate about, that people, you know, whatever their age, whatever their circumstances, it's about their quality of life and maintaining that, or improving that. And we do a lot of training with care providers who look after sort of older people, but also just generally as people age, and they might not be being looked after by anybody, but it's about making choices themselves. So, you know, as we get older, or looking after an older person, are there any sort of tips or advice that you can give?
Yeah, so if we're talking about older people specifically, there are probably a few things that I would think about. So the first one would be texture, because it might be that people find chewing and swallowing a bit more difficult, so we'd have to think about what they can eat and what they're able to, you know, to chew and swallow. We also would think about having a really nutrient-dense diet, because older people sometimes have smaller appetites, so you need to get the nutrition in to a smaller quantity of food. So that is, again, something that would have to be sort of tailored really for that person or that age group. And then, as with anybody, you really have to take into account people's sort of preferences and lifestyles and that sort of thing. And, you know, maybe somebody who is a little bit older might really enjoy having a cup of tea and a piece of cake, you know, when they have people around or visitors or whatever. And, you know, we don't want to say that, you know, you can't do that, because that might be really important to them. So it's about looking at ways that they can have that, but have a less of an impact on their blood glucose levels. So that would be things like, you know, making the cake instead of, you know, white flour, which is broken down very quickly into glucose, you can replace those with things like ground almonds, and that makes a really nice cake. Or maybe something like carrot cake, which has the carrot in and then adds extra fibre, which sort of slows down the absorption, and nuts in. Quite often you get walnuts in there, which again, source of essential fats, so that would be a good option. So it's about thinking of how we can sort of work within people's sort of preferences. And it might be that, you know, maybe they don't like carrot cake, and so maybe they just have a smaller portion of whatever it is
Yeah,
that they actually want.
Absolutely, and that's kind of like an easy way of doing that, isn't it, as
exactly.
well? Yeah.
But you know, there are different things that we would think of for you know, different groups of people. But again, it comes down to this sort of individual, you know, tailoring to the personalising for an individual person.
Yeah, no, absolutely, and I should say if especially somebody that's older and if they have got a little bit of a sweet tooth, you're not going to deny them being able to have their desserts and their sort of cakes and what have you. But I suppose that the other thing is that the way that can be balanced is that, you know, you look at the meal as a whole. So that whatever they had in their savoury, you know, in their main meal, that you could look at the carbohydrate content of that.
That's right. Yes.
And sort of reduce that a little bit so that they're having their dessert. So overall, their carbohydrate and their blood glucose will not be massively
that's right.
impacted. But I then presume, you know, from that point of view, you know, they're at the age that they are. It's about quality of life. It's not about worrying about complications that might happen in 20 years' time, because if you're in your 80s, that's perhaps less of an issue.
Exactly.
Whereas somebody younger, would you say, obviously if you were working with somebody that was in their 40s, for example, you perhaps would be having different conversations about how often they would have that dessert and that cake.
Yes, totally. And that's it. It is about working out what's right for that person. As you say, if an older person wants a little bit of cake every day, well, you know, there are ways to manage that. It's certainly not something I would really recommend for younger people that have much longer to develop the complications, the very serious complications that can come from having type 2 diabetes if it isn't properly controlled.
And they come from the fact that if their blood glucose level is constantly at a level that's higher than that is
optimal,
acceptable, and optimal, then absolutely they will run the risk of having some of the problems further down the line. So at the start, when we began our little chat, you mentioned other aspects that can have an impact on blood glucose control. Could you elaborate a bit on them? Can you tell us a little bit more?
Okay, well, so as we've spoken about today, so food and drink is probably the major driver. But there are other really important things, and these are stress and exercise, self-care, and how well people sleep. So it's almost a whole other topic. So I think we might have to do another little chat about that another time, because there's a lot to sort of go into on that one as well.
No, that would be great. We will do. I'm sure. Yeah, brilliant. We'll definitely cover that section again. But it does highlight. It's about the whole person,
Definitely,
isn't it? The whole of their life. You can't really just carve out. Let's just talk about, you know, food and drink and ignore everything else, because it is also interrelated, and that's true for all of us, isn't it? Not just people with type 2 diabetes. It's for all of us. But yes, right. we'll do. So it's been really interesting listening to what you've got to share with us this morning, Rachel. Thank you so much. And so how can people find out more, really?
Okay, well, it's been my pleasure chatting as well. Thank you for asking me, Lynn. So people can email me. My email address is rachel@rachelpagenutrition.co.uk, or my website is rachelpagenutrition.co.uk, and people can find out a little bit more about how I work on there, and they can contact me, and I'd love to hear from people, and I'd love to be able to start helping them, because that's what we're here for.
Brilliant. Thank you. Thank you
very much.